Before we talk about specific types of surgery and the specific risks to that surgery, it's important to understand that any surgery has risks. There's always a possible risk of things like bleeding, although that's quite rare around the eyes, infection, and then also there's always risks of scarring and anesthesia. Upper blepharoplasty surgery, or an upper eyelid lift. So that's where we're removing extra upper eyelid skin on the upper eyelid and trying to get more tarsal platform shell, which is basically the distance from your eyelashes to where that fold starts. That's the purpose of an upper blepharoplasty. So with an upper blepharoplasty surgery, we are removing the extra skin on the upper eyelid. We're not removing all of the extra skin because you have to have some skin left around for you to be able to safely close your eyes when you blink or when you sleep. However, one of the risks of surgery is that too much skin gets removed, or for one reason or another related to that or the scarring, the eyelid doesn't close afterwards. That is all of my patients' worst fear, is that their eyes won't close after surgery. This risk is rare, especially in the hands of an experienced surgeon who's been doing this a long time and specializes in eyelid surgery. It's not that common, but it's important to know that anytime we remove skin from the upper eyelid, we always have to know that we need some of that skin left over for us to be able to close our eyes. Second risk specific to upper blepharoplasty surgery is something we already talked about, scarring. Usually the scar, if hidden in the natural eyelid crease, is not noticeable. It can heal very well over time. Sometimes though, you can get what's called a hypertrophic scar, which is when the scar gets thick and elevated, and that can require some potential more treatment to try to treat that scar. Lastly, and this is kind of one of those things you don't want to hear, but it's true, is that sometimes we remove as much extra skin as we can, and yet after surgery there is residual skin left over. Now that might be because the procedure kind of pulled down the eyebrow, or it might be because the skin just kind of swole up after surgery and kind of distended a little bit, stretched, and then it kind of overlays again. This is a very common thing actually, that sometimes there is a little bit of extra skin left over, and sometimes we have to go in and do a revision after surgery. But it's important to know that is one of the risks of upper blepharoplasty surgery.